Hi everyone. In this clip, I will talk a little bit about yeast overgrowth or candidiasis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. Yeast overgrowth or candidiasis is a fungal infection caused by an excessive growth of a type of yeast called Candida. While Candida is a normal inhabitant of the human body, living on the skin and in areas like mouth, throat, gut, and vagina, it only causes problems when its population grows out of control. The common forms of candidiasis are vaginal candidiasis or yeast infection. This is one of the most common forms, characterized by symptoms like itching, soreness, and white or yellow discharge. We have oral thrush, which is overgrowth in the mouth or throat, leading to white patches on the tongue and inside the cheeks, along with redness and soreness. We have esophageal candidiasis, which is an infection in the tube leading from the throat all the way to the stomach, which can cause pain and difficulty swallowing. Skin infections. Yeast can overgrow in warm, moist areas of the skin, such as in skin folds, causing a red, itchy rash that may ooze sort of clear fluid. There's also one kind called invasive candidiasis. This is a severe form where the yeast enters the bloodstream and can affect internal organs. It is more common in hospitalized patients and those with weakened immune systems. Diagnosis of candidiasis depends on the location of the infection. In case of vaginal candidiasis, a healthcare provider may take a sample of vaginal discharge to examine under a microscope or send it for a fungal culture. For oral thrush, this is often diagnosed by visual examination, or a sample also may be taken for lab testing. For esophageal candidiasis, this is typically diagnosed with via endoscopy, procedure that uses a camera to examine the digestive tract. For invasive candidiasis, this is diagnosed through blood tests or by culturing a sample from an infected area. Classic treatments for candidiasis involve antifungal medications, which are chosen based on the type, location, and severity of the infection. Topical antifungals, for example, are given and for the skin and mild vaginal infections. Medicated creams, ointments, or suppositories are commonly used, and many of these are always available over the counter. Then there is oral antifungals. These are prescription pills which are used for more severe or recurrent infections, as well as candidiasis of the esophagus. Then there is intravenous or IV antifungals. For severe invasive candidiasis, this may be administered through an IV in a hospital setting. Nutritional approaches often focus on creating an environment in the body that is less hospitable to Candida and supporting the body's natural defenses. The Candida diet is a popular nutritional therapy that aims to starve the yeast by eliminating its food sources. The best, of course, is always prevention and flourishing the healthy gut bacteria. So foods to avoid are things like sugars and refined carbohydrates. Candida thrives on sugar. Eliminating all forms of sugar, including refined sugar, sugary fruits, high fructose corn syrup, is a cornerstone of the healing process. Also avoiding yeast or mold-containing foods. This includes things like bread, beer, and some fermented foods initially. Processed foods, these often contain hidden sugars and can contribute to inflammation. Foods that are good to eat are non-starchy vegetables like leafy greens, broccoli, Brussels sprouts, asparagus, and other non-starchy vegetables, or lean protein like chicken, fish, eggs, and grass-fed meats. Healthy fats like avocado, olives, coconut oil, and olive oil. Grains, certain grains like quinoa, millet. This can be allowed in moderation, actually not a whole lot. Then antifungal foods like garlic, ginger, and turmeric are often included in their natural antifungal sort of properties because of their antifungal properties. Pre- and probiotic rich foods like plain yogurt or kefir without added sugar, of course, and sauerkraut can help replenish beneficial gut bacteria, which competes with Candida. I have a clip on actually the pre and probiotics that you may find useful in that. When it comes to supplements, probiotics are often recommended to restore a healthy balance of gut flora. Oral supplements like other oral supplements like omega-3 fatty acids and vitamin C can help boost the immune system. When it comes to metaphysical and emotional causes of candidiasis, physical health is intricately linked to emotional and spiritual well-being. So the contributors can be feeling overwhelmed and disempowered. Candida is a fungal overgrowth. And in metaphysical terms, fungus is often associated with a sense of being overgrown or taken over by an external force. This can correlate with feelings of being overwhelmed by life's circumstances, responsibilities, or the opinion of others. Lack of control. So the loss of the body's natural balance can mirror a feeling of lack of control in one's life. The Candida overgrowth can be seen as a physical manifestation of a psychological state where one sort of feels their boundaries have been breached or their autonomy sort of is compromised. Also, the Candida diet's focus on eliminating sugar can be seen as metaphor for addressing the emotional need for sweetness or comfort. Overgrowth may be linked to a craving for something missing in life, leading to a reliance on external sweet things like sugar that are ultimately detrimental. This can point to unfulfilled emotional needs or a tendency to seek external validation. Also, rejection of self. Chronic yeast infection can be connected to a rejection of one's own identity or sexuality, particularly in the case of vaginal candidiasis. Chronic stress and anxiety can be a factor. There's a well-established link between chronic stress and a weakened immune system, which can make the body more susceptible to Candida overgrowth. From a holistic viewpoint, this is the physical manifestation of an emotional state of chronic unease and anxiety. The body, under constant stress, cannot maintain its natural balance, basically. Hope this has been helpful. Like and follow for more. Be the light.